Everyone's recovery story is a little bit different, but I'm happy with mine. It wasn't hard, but it wasn't easy either. And if I'm being honest, that's kind of where I'm comfortable. Just like I want to feel like I'm doing something, like I'm being strong or I'm earning something. Not really sure why. So after many years of struggling with my weight, I decided to take the plunge and get weight loss surgery. I had it in 2014. My highest weight was 525 pounds, and I was just sick and tired of being sick and tired. So one of the things that held me back was trying to get my head around like what recovery looked like. The fear of getting surgery. Like surgery is a little bit scary when you think about it. Or more precisely, the fear of not knowing what it was going to look like. Starting at the beginning, the night before surgery. Like I had like this like anxiety, like, oh, I gotta pack, oh, I gotta buy stuff, oh, I'm not ready, I can't believe it's already here. If you're someone with anxiety, that may sound familiar, and I think I definitely had that. There were moments in the day where I would forget about it, and then it would hit me, and I'd be like, oh my god, like this is coming soon. The night before surgery, you ever have those nights where you have something important the next day and you're like, I need to sleep? It was like the worst night of sleep I think I've had. I was just putting too much pressure on myself. The day of surgery, my then best friend, now fiance, which is very cool, she brought me. We went to St. Vincent's Hospital in Worcester, Massachusetts. It doesn't look like a typical hospital. It actually looks a lot like a shopping mall. It's like a square, and then you walk around the perimeter of it, and then in the middle there's like this like atrium. It's got like chairs and stores and a Dunkin' Donuts and like a waterfall. Like I swear I'm not making this up. It's definitely weird, but I liked it. I especially liked it because that was where I picked up the habit of walking. Now I think about it, man, cool. So I remember walking around because we got there a little early, and I just remember thinking to myself, like, I'm gonna be okay. This is for the best. This is the best decision I could make myself. Trying to remind myself, like, what got me there. My process took over 1.5 years to get approved for. It was a labor of love. That sucked. It sucked so hard sometimes. Easily one of the more challenging chapters of my life, but I'll go into that some other time. I just remember saying to myself, it's gonna be okay. I'm gonna come back to the waterfall tonight, and that's the promise I'm making myself. Like, I think in my head, as scared as I was, if I can just pretend to be strong, maybe I can be strong. I remember being brought into pre-op, and they make you wear the gown. And back then, I'm so big that I had to wear 2 gowns, and I'm all tied up, and it was a sight to see. I remember, the nurse came in and she was like, congratulations, and she was super kind, and it felt nice, because I had to lose 100 pounds on my own to get approved for surgery. So I went from 525 to 425. You wouldn't know that I was working on my weight as hard as I was. So it felt good when the nurse opened my chart and she saw the difference, and that just felt good. I remember laying there, and then they were like, okay, it's time to go. And I remember getting choked up. It was the combination of everything, accomplishment, feeling like I finally made it, being scared, being wheeled away from my best friend, it was scary. That period right up until they wheel you away. Actually, even before that, maybe a day before, maybe a week before, maybe after you get approved. I think that's when fear sort of comes in and sort of takes the wheel a little bit. I can't tell you how many times I wanted to just say no thank you. Even though I spent so much time and money and effort, getting approved to get to this point, I was trying to talk myself out of it. And that's very common. And I bring that up because if you find yourself in that position, know that a lot of us have been there. And most of us feel very silly after the fact. You're like, what was I thinking? I got into this because regular diet and regular exercise weren't working for me. Then I got approved for surgery, and then suddenly you're like, maybe we'll try that old diet and exercise thing again. It's a funny thing that the brain does. I think it's a natural response to, feeling afraid. We want to get away from it. And I definitely would be lying to you if I didn't say, while they were wheeling me away, I was like, I could say stop. I could say no thank you and, put my clothes back on and go back home. But I didn't. And I'm so glad that I stuck with my guns on that one. because I was scared. I was so scared. I remember tearing up as they were wheeling me out. I remember I had tears in my eyes when they put the mask on me. I remember being like so amped up but so calm at the same time, because at this point they're giving you drugs, they're making you feel comfortable, but physically I could still feel like a little bit like I was gripping the table. I just remember them putting the mask on. I remember being grateful. I remember saying thank you guys so much, because I was terrified and I wanted them to like me so that they would do a good job. Yeah, I don't remember anything after that. My surgery lasted for about an hour and a half. I woke up in post-op. My now fiance was in the room with me. We weren't together, we were just friends at that point. She actually took this picture of me, which I'm so grateful, because I wasn't trying to document anything. And now that I talk about this stuff very openly, I'm kicking myself I don't have more photos. I wish I did. I just wish I felt better about the way I looked back then. I would have taken a million pictures. She snapped this picture of me, and as you can see, I have my arms up in the air. For some reason, I was talking gibberish. I was talking about what we would need to live together. I was sort of spilling the beans coming off of anesthesia. I mean, is what it is. It worked out. It's cool now that I look back on it, but soon after that, I was not too thrilled about it. Yeah, not back, no. So you wake up and you might be a little confused of where you are. So normal. After I woke up, they brought me to my room. I got my own room. I just remember feeling out of it. I had a long trip, and I remember being oh my God, I need water. I'm so thirsty. My mouth was just super dry. I had dried blood on the side of my face. I was just dying for water. But I remember them telling me that being able to sip water or have a little bit of water right after surgery was just not going to happen. And I think that made me panic a little bit. Luckily, the nurse was nice enough. She gave me it had it was a white stick with a little sponge on the end, and I could just kind of swab my lips with ice water. But that calmed me down. The gas pain. That gas pain will make you do anything. That gas pain can be very persuasive. The gas pain is easily the most uncomfortable part of the surgery, just because pain medication doesn't really affect it. It just feels like an internal pressure inside of you, and it's uncomfortable. They do say, the best way to get rid of it is to walk. And I had 4 or 5 cuts in my abdomen. I was tired, I was cranky, I was thirsty. As you can imagine, I wasn't trying to walk. I wasn't trying to get out and do stuff at that point. I was just kind of a big ball of misery at first. Plus they put these balloons on your legs that just puff up so you don't get a blood clot. I just felt a little on the uneasy side, and I just really wasn't looking. But that gas pain, holy moly. I want to say the first night I slept in a chair. It was that uncomfortable. Laying flat, it just didn't feel great. And then, you have this gas pain pressing in on you. Making that transition up and down, not comfortable. Really not comfortable. So I think once I got up for the first time, I was F that, I'm not doing that again. And I just sort of sat in the chair and just was there. Eventually the gas pain got so out of control that I was I will do whatever it takes to get this pain out of me. I remember being up at 1 a.m. I was praying for farts. Wanted them so bad. Farts, burps, any way I could get that pressure out of me, I was signing up for. I just you know what, forget it. I'm just gonna get up and go. I just grabbed my headphones and I was you know what, I'm just gonna walk this off until I can't walk anymore. I ended up doing a lap around the ward. Then I got sick of that, and then I ended up going out the exit into the main hospital, that mall area I was telling you about. And it was absolutely just gorgeous. It was beautiful. It's got a glass ceiling so you can see the stars, and it was lit up. It's got fake trees and Christmas lights, and it was really a good place to recover. It's actually very magical. It really was. And I just walked around for a while and just was taking it all in, the gravity of the change that I had just signed up for. Thinking about the day, thinking that I finally did it. Completing something has always been a sore spot and an Achilles heel for me. I always seem to just get to the point where I'm about to, finish something, and then I just take a U-turn. And I despise that about myself. It felt good to see something through, to sign up for something, go through it, get to the end, and then actually, complete it. And there were just a lot of good feelings that night. And eventually, being on my feet as much as I was, the gas pain sort of settled a little bit, so it became a little bit more manageable. And that obviously encouraged me more to walk more. I ended up going back to my room, and when I got there, the nurse looked like she had seen a ghost. Apparently I had been gone for a while. They were like, "Where's this patient?" They actually thought I had left. I was like, no. I'm like, I'm very much still a patient. I still very much need medical attention. I just went for a walk, and they were like, "Oh wow, good for you." You know, that's kind of like the thing that they have the hardest time with patients, is getting them to walk, you know, the night of. Because everyone always says, "Oh, the first night you'll be walking," and some people can't fathom that. I mean, I certainly was in that camp for a little while, but bring a pair of crappy shoes that you can just slip on and go walk. It will do wonders for you. It will make a seemingly awful situation feel a little bit better. So I was in the hospital for about 2 days. I just wanted to make sure that my pain level was under control. Just because, like, at that point, I didn't necessarily have, like, I guess you'd call it like a home to go home to, if that makes any sense. I was finalizing my divorce. I was in college still. I was living on my mom's porch on a chaise lounge that she had in the corner. So, like, with that beautiful setup in mind, I didn't want to go home and be in pain, because I was really like in survival mode at that point. It just was super uncomfortable. So it's just something to look out for as you recover. I went back to my room, eventually got discharged. My buddy picked me up, and he brought me back to my mom's porch. And yeah, that's where I recovered for, like, you know, the first 3-4 days. I don't remember there being a lot of pain after I left the hospital. I didn't want to touch the pain medication because I wanted to be able to drive. I had surgery on a Monday, and then my divorce was finalized on that Friday. So when I got back home, I didn't touch my pain medication. You know, I thought there'd be some sort of like court rule, you know, not being able to testify under Oxycontin. You know, I didn't want anything like that to happen. So like, I went home with the mentality that I wasn't gonna touch it because I couldn't. I just sort of pushed through. There was a little bit of pain, of course, but you know, I think mentally I was more motivated to, you know, just push through. I do remember feeling very depleted in terms of energy. Like, I would just sort of like roller coaster. I'd be like, I feel so good. No, I don't feel so good. Oh, I feel so great. Now I need a nap. Like, I remember going through that for about a week or so, maybe a week and a half. That certainly was an adjustment period, no doubt. And then, you know, just tons of walking. Like, I made the best out of a pretty bad situation. And then to watch the weight come off the way that it was, and people were noticing it. It was all very, you know, fast, if that makes any sense. It's kind of a blur. That's like a monumental, like, moment for me, that period of time. I can't imagine, like, where my life would be without it. You know, the good parts and the bad parts. They're all important. You know, everyone's recovery story is a little bit different, but I'm happy with mine. It wasn't hard, but you know, it wasn't easy either. And if I'm being honest, that's kind of where I'm comfortable. You know, just like, I want to feel like I'm doing something, like I'm being strong or I'm earning something. Not really sure why. I feel like maybe it's because I have something to prove, I think. But I hope my story helps you a little bit in writing yours. I understand that the recovery piece is certainly one of the scarier components of it. You know, obviously there's other things to fear after surgery, but the recovery is always one that's a little bit more obvious to people when they're thinking about it. I would do it again in a heartbeat, but it helps to have a good friend with you, like a really good friend. Like, I'm so grateful. I always think, like, if I could make it through, if I did it and I made it through and I got to the other side, you know, I really do feel like anybody can. Like, I was a total mess when I started. Yeah, I don't know if I would have bet on me. And I'm so glad that it worked out, but I'm probably gonna cut that part out because that's too true. It feels too true and too mean. But I hope this helps you make your decision one way or the other. It's a very personal decision. I really do encourage you that you need to come up with a number of reasons to do it, but the first one at the top needs to be you, because nobody will experience it quite like you. They can witness it, and they may even deal with you at times, but you're the one going through it. You're the one making the sacrifice. Like, the number one reason needs to be you. Hope that helps. If there's any other questions around recovery that I can answer for you, please leave them in the comments. If there's any other part of this process that you'd like to hear a story about, please let me know. I'm always here to help. And wishing you a happy bariatric journey. We'll see you next time.